Welcome to the Four Eyes podcast, brought to you by Young OD Connect. We give you a clear view into the new grad optometry world across Canada and the US. And we are your hosts. I'm Dr. Amrit Bilku.
And I'm Dr. Deepan Kaur.
And today we are bringing back the new Grad Case Reflection series. We're kind of excited because this was a really popular series that we did, my goodness, like 3 years ago. It was a really good series. Everyone gave us a lot of feedback, positive feedback about those episodes. And because it wasn't really talking about a case and talking about, here's keratoconus, what are the symptoms, what are the findings, but it was more of how did we handle a situation with a certain patient in clinic as a new grad? What mistakes did we make and what did we learn from that experience? And we really wanted to bring that back because I think we just haven't talked about clinical care in a while. And I think because now, Deepan, you probably agree, I feel like we're kind of transitioning away from like being a new grad, but we're still young enough that we're in the new grad
We're
category.
getting seasoned. We're becoming seasoned optometrists.
We got a little salt and pepper coming through.
I do. Look at
Me
that.
too. Oh my God, me
For the
too. I'm getting the
people who
gray
can't
hairs.
watch or is not watching our video, me and Amrit are just pulling up our hair to show our gray hairs.
Yeah. 2024 was the year my grays really started coming through. So yeah, are we new grads? I don't know. But patient care, I mean, luckily now to us is so routine and we're more confident in our skills. But Deepan and I a few weeks ago were talking about contact lenses. And I brought up this memory of, oh my goodness, the PTSD of this one patient when I was a new grad, first year out, working in a corporate practice. I had this contact lens abuser. And then Deepan and I just really got into that conversation and we were like, wait a minute, you've experienced that. I've experienced that. There's probably been a contact lens abuser for every single new grad out there. And I'm sure you wanted to rip your hair out trying to handle this sort of a patient. And so, yeah, I wanted to talk about that today and share a case where I had a really difficult patient with contact lens abuse and kind of like what was going through my mind. And I want to know how Deepon would handle it. And then, you guys can always send us messages and let us know how you would have handled a situation like this. And I just hope it teaches you guys a lot of stuff and helps you guys in your journey as to how to handle these crazy patients.
Yes. The non-compliant patients.
Oh.
Yeah.
Honestly, I'm not going to lie. I think, like, before we even get into that case, contact lens abusers in general are one small category of patients that I really just don't enjoy talking to. Like,
Well,
it's
it's
not like, I don't
interesting
know.
too,
I just
because
don't.
even when I was like Googling, like, oh yeah, like what is Google saying? Or like, what are we saying about
Yeah.
how to handle non-compliant
Yeah.
contact lens abusers, right? And honestly, like, there's no advice, and I know we're going to get to this later on. There's no advice of just saying, no, I'm not going
Yeah.
to give you contacts anymore. It's like a list of constant, like, okay, you got to tell them
Yep.
over and over and over again. Make sure you're doing follow up after follow up. If they're still
Mm-hmm.
abusing, your message is not clear. And it's just like, well, hold on. Like, why, if they're
Yep.
going to be abusing the contact lenses, they're not going to follow our advice. They're not going to come back for these follow-ups. We can
Yeah.
easily like, you're not getting a contact lens prescription from me. You're not getting any more contact lens trials from me. Like, it was
Yeah.
so hard to find that piece of advice
Yeah.
on like the internet or like what
Yeah.
even like other optometrists are saying. And again, it's just, I feel like it's just with the optometrist personality. We can't
Yes.
say no. We
Yeah.
can't
And
say
you know
no. We're
what?
too nice.
This is very similar to taking away someone's license,
Yeah,
right? For like a
yeah, I
low
get
bit, like how, okay, yes, we've learned you have to, if somebody in your chair does not meet the driving requirements on
yeah.
that day, you're taught, okay, take away their license, like take it, call them a taxi, report them, blah, 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 blah. But when you're in the chair with that person, like there is no training to really navigate that situation because it is a
Yeah,
touchy topic and you don't know how your patient's going to react, right?
exactly.
It's tough. So hopefully new grads nowadays have better resources, hopefully at school to kind of figure out how to navigate those situations. I don't know.
Mhm.
We really did not have a lot of guidance
Well, I think it's
dealing with
because we're
that.
not taught like I guess, the emotional side again of
Yeah.
our job, like conflict resolution. How do you deal with the emotions of patients? And I think we
Yeah.
kind of always bring this topic into every one of our episodes because, as I always say, our jobs are like sometimes handling emotions or managing emotions and just kind of figuring out
Hmm.
how are we going to deal with
Yeah.
this person today, even though we know exactly what we're going to do. But like, how do we say this to this
Yeah.
person? I mean, that is, I guess, all of healthcare, but like, it's just, we're not really taught that
Hmm.
part of
Yeah.
our job in school as much
Yeah.
behind the
And
scene.
last thing
Yeah.
I wanted to I wanted to add because when we talked about this last week off the podcast, I don't know if anyone else agrees before we get into the case. Do you guys find that contact lens abuse patients are kind of like their own personality too, where they don't give an F? Like they will just they sit in your chair and you're just like, "Hi, my name is Doctor This. How can I help you today?" And they're just like, with their back like leaning against the chair, looking at you with their eyes, like kind of
Waiting.
squinting at you, just kind of like, yeah, I sleep with my lenses every day. I haven't taken them out in 6 months. What? Like, what are you gonna do? And I'm just like they're just so open about,
Yeah.
yes, I'm not taking care of my contacts properly. What are you gonna do about it? And I'm
Yeah.
not gonna listen to anything you have to say. And then I'm like, okay.
Yeah. No, I know what you mean. It's
Thanks for
like,
telling me that you sleep in them
I
for,
know that's what
six
every
months.
optometrist response is. Thank you for being honest with me.
Yeah,
And
like
you're
why
just
are they
like,
so
oh my
honest
God.
and like proud that they haven't gotten an infection yet?
But
Yeah.
again, it's like talking, but you can't, this is the thing. Like when you mention all of these things to the patient that we're talking about, they're not going to understand that. They're going to be like a peripheral ulcer, whatever. I don't care.
Yeah.
And even an infection, they're going to be like, well, I've been overwearing my contacts for the past 3 years. Nothing has happened.
Yeah.
But
So
it's
why would
like,
I care about an
yeah.
infection?
And it's
Yeah.
like, okay, but that one time something does happen, do you understand how serious the situation is? Like,
Yeah.
I don't know. And I think that's where the problem comes from. And also, contacts are like sold all over the place
Yeah.
without being regulated. So people don't
Mm-hmm.
realize like
Yeah.
how bad it is. Or
You
people
can't
will,
blame them. Yeah, you can't blame them if
yeah,
it's being sold in like a grocery store half the time. It's just
yeah.
like,
They're like,
okay,
oh,
well,
yeah. But
what
it's
can't be
crazy
that
to
bad.
me. It's crazy to me that concept of just putting something on your eye
Mm-hmm.
and not being like,
Yep.
"Oh, maybe I should get this checked." Like
Yep.
that is crazy to
Yep.
me. People
I
are
know.
like, "Oh, there's some contacts at this, you know, outdoor random store in a warehouse." Oh,
Yeah.
look, they're selling stuff. They're selling colored contacts. Let me just grab those
Yeah.
and let me just put them on my eye. Hopefully everything turns out okay. Like that
Oh my
is
goodness.
mind-boggling to
I
me.
know. I
I don't
know.
get that.
And so we'll get into the case because this I don't have the exact data with me anymore because that case I saw back in 2020 or 2021 when I was in a corporate
Mhm.
setting. So I don't have access to those files anymore. But
Mhm.
I vividly remember a lot about this patient. So why don't we get into it? I saw a patient who was probably in her mid to late 40s, a woman who has a high prescription, around -6, -7. We find that maybe that's typically, the people who abuse their contact lenses because they don't want to wear their glasses because
Yes.
that aniso is just so, and that minification just really throws them off. She came in, new patient, never been seen before. She wanted an update in her contact lenses because her prescription expired. She tried to purchase some more online, and then the online, luckily, I don't know where she purchased them online, but surprisingly, they declined her order with an
Oh,
expired prescription. Yeah, which, by the way, new grads, that doesn't happen very often. Patients are using their 6-year-old contact lens prescription
yes.
to purchase contacts online because it's not regulated and they'll still get them.
Yeah.
So this patient came in very disgruntled, very upset that she had to, get an eye exam. God forbid, it's such a barrier to getting her contact lens prescription.
Yeah.
Tried to check VAs first, right? I didn't check the contact lens quality or her cornea first. She was best corrected to about 20/50, 20/40 in each eye. And in Ontario, your driving limit is 20/50, right? So
Yep.
she just passed the driving limit. This isn't a situation where I'm taking away her license, but obviously she's struggling to read
I
20/40.
mean, that's
Yeah,
borderline like
pretty
scary.
right,
To be on the
borderline.
road with 20/40 vision.
Yeah.
Great.
Yeah,
Great.
not good.
Not good.
And
No.
then tons of glare, tons of halos in her vision. So then eventually, looking at the contact lenses, just like Deepan's mentioned before, obviously tons of protein buildup, disgusting. Like honestly, like mucus buildup, protein deposits, everything on the lenses. Had her take them out, tons of infiltrates on the eye. Are they
Oh.
active? No. They're all old. There's luckily no staining, no ulcer, so nothing infectious, which is good, but tons of infiltrates,
Ugh.
lots of stromal edema, lots of swelling, and then lots of haziness around the corneas. Without the contacts on, obviously, her eyes were extremely sensitive, light sensitive. So there's definitely
Right.
some inflammation going on. Then I started her up on some steroids. Honestly, at this point, I cannot remember exactly what I prescribed or what dosage. But gave her steroids, lots of artificial tears, Advil, all that kind of stuff, and Miro 128 for the
Mhm.
corneal edema. Then I had this long discussion with her and asked her more questions because she did not tell me a lot of information about her contact lens
They
wear.
never do.
They never do. And as a new grad, that was my first mistake. I didn't
Yeah.
really ask her more details in the beginning of, how often do you wear your lenses, remove them, blah, blah,
Right.
blah. All I knew during case history was that they were monthly lenses. And she's
Hmm.
worn contacts for years. And
Years.
she
Yep.
has no glasses at home as a backup pair.
Right.
Then I asked her more questions and she says, "Well, yeah, I sleep in my lenses every single night. I haven't taken out this pair for probably 2 to 3 months."
And this is not
And
a pair that you can sleep in,
no, no,
right?
this is not
Okay.
an extended wear. I mean,
Here. Okay.
and honestly, for any new grad out there, get ready. Every patient will say, "I don't know what brand I'm in. I think it's AccuView."
Yeah, literally word for word. Yes, I don't know what brand I'm in. I don't know what the prescription is. I wear these every day. No idea.
But it's
And you're just like,
AccuView or the box is blue. And then you're like, cool, thumbs up. And it's
literally,
always Air
I,
Optics after the fact.
that's so true. Literally
So
word for
true.
word what you just said.
Yep.
Every time at my clinic
Every
too.
time.
All the time. All
Every
the
time.
time.
So no, they were just regular monthly lenses. No idea what the brand is, but she said AccuView, whatever. And so then I had that conversation. I was like, okay, well, it's not good to wear your lenses and blah, blah, blah. And now I said, you have inflammation. You have to put these steroids in minimum like 4 times a day. You have to be out of contact lenses. And this girl flipped. She was so angry with me. Like she was angry, pissed off, really, I don't know, offended that I was like, you can't wear your contacts. And she's like, "What do you mean? How am I supposed to function? What the hell are you talking about? What am I supposed to do? I have work, I have kids, I have this, blah, 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 blah." And I'm like, I, you have to get glasses.
Yeah.
And no, I don't want to get glasses. I don't like wearing glasses. You will get these patients that are just so stubborn and frustrated and like they just do not want to do what you're recommending. Right. So at this point, I'll pause because that's what we always want to do. We always want to ask each other, what would you do? So you've told the patient, you've given the treatment plan, no more contact lens wear. She's -6. She needs glasses. Patient's refusing. What would you do at this point, Deepon?
Well, I'm thinking back in 2020. Yes, when we were new grads, I would be my anxiety would go up so much. My heart would be racing because now there's an angry person if I
Yep.
share
Oh,
that I have
100%.
to
Yep.
somehow emotionally manage because I'm not telling her what she wants to hear. But I would ask about the glasses. I'd just be like, what is the issue with not getting glasses? Like, I don't understand. Is it
She
like
doesn't
a
like the minification.
okay?
Literally, that, yep, she doesn't like that everything looks wonky, distorted, everything looks small, it feels too strong. She
So
doesn't
this
like
is
frames
okay,
on
and
her
this
face.
now this kind of depends on the clinic you're at and what kind of equipment you have. So if I had an
Mhm.
anterior segment camera, I would show her what was going on with her corneas and try to show
Ah,
her
that's a
this
good.
is what's
Yeah.
happening with your eyes. But if I didn't have that, I would try to show it, like try to take a picture on my phone, my iPhone.
Mm-hmm.
And if I wasn't able to even show that, I would try to Google photos and be like, look, this is what your eyes look like. The
Mm-hmm.
issue with that though, the Googling of the photos, if it's not their eye, I feel like
Yeah, they
it's
don't
people
really.
are like, they don't believe it. And she didn't feel any pain, right?
Yeah.
Or too much
Well,
like,
well, when the contacts are on, no pain. Yeah,
oh,
and she
okay.
wears them full time.
Right.
Taking out the contacts, she was extremely light
Mm.
sensitive. I mean, also, do you know how much like SPK was on there? Yeah, it was, a lot of dry eyes,
So,
chronic
yeah,
inflammation. Yeah.
I feel like if you had certain equipment like the anterior segment camera, that would be a lot more easier to convince
Mm,
patients what's going on because
yeah, that's a
they're
good
looking
point.
at their own eye and they're like, what is that? That's
Yeah,
my eye.
yeah.
And that would be more convincing. But if, I don't think even when we were new grads, none of us really were in a clinic like that at that time.
No.
Honestly, I would try to remain calm but stern and Google the photos of what her eye looks like and tell her like this is the situation, this is where
Hmm.
it can go. And if if the treatment plan, the management plan is not followed, there will be a point where I won't be able to prescribe you contact lenses anymore.
Yeah,
So how would you want to deal with this? I know that conversation back in 2020 for
would be
me, I'd be
tough.
sweating bullets. Like,
Yeah,
because this woman
yeah,
is also much older and
yeah.
probably like, I want this now. And
Yes.
like, you know what I mean? So
Demanding, very
demanding.
demanding, very
Mhm.
not yelling and screaming, but definitely angry with you. Like
Yes.
angry at the fact that you are not giving her what she wants, right?
Yeah, and
So,
I've
yeah,
I've been in another
very frustrating.
situation where it wasn't me, but there was a patient who called in and wanted to book in for a contact lens exam. And I didn't see them the year before. It was one of my colleagues, and I read her notes, and she documented everything about this patient, about how this patient was a contact lens abuser and would not prescribe contacts to her.
Hmm.
And when we were booking this appointment, when the my front team was booking the appointment, I told them to let her know that, when we're doing this exam, the doctors have access to her records. We can see what the other
Hmm.
doctors have said, right? So
Yeah.
she still might not be getting contact lenses through the other doctors,
Hmm.
right?
Yeah.
She flipped out and started swearing on the phone and calling the doctor she saw previously names on the phone.
Oh no.
So
I'm
now
telling you, these people are a
I know, but then
personality
the front
type.
team was
Like
like, "Oh,
it's,
hey,
yeah.
Dr. Carr, do you still want to see her?" I'm
And you're
like,
like, nope,
"No,
nope,
I don't
nope,
want
nope.
to see this patient. I don't want to see this
Yeah.
aggressive human being who doesn't care about their eye health at all and just wants
Yeah.
to get contact lenses." Like,
Yeah.
I was like, "Well, honestly, no. This happened more recently." So I was like, "No, I'm ready to have a discussion with her. She wants to talk to me. Let's talk." But if I was like a new
Yeah.
grad,
If you're a new
I'd
grad,
be
it would be
like,
very like nerve-wracking.
I'm nervous now. I don't want to deal with someone that's angry with me. I'm just
Yeah.
trying to
Yep.
get through one day at a time. I don't
Just
want to,
trying to live.
yeah, just trying
Just
to
trying
live.
to
Yeah.
educate people about keratitis here. Nothing else.
Yeah, exactly. I
Yeah.
mean, now
No,
I'm
it's
more
true.
like, oh, yeah, I'll have a conversation with this patient. No problem. But
Yeah.
like, like you don't, in that
Yeah.
kind of patient, is going to throw off your whole day because there's going to be emotions that
Yep.
are going to run wild. You're going to have to calm yourself down. You
Mm-hmm.
just know. But yeah, honestly, like I would try my best to educate the patient,
Good.
but
Yeah.
then
Anterior
if
seg
it's going,
photos are a great idea. So yeah, we
yeah,
we did not have an anterior seg camera at that practice, and but I do agree with you when you show patients images of their own eyes, sometimes it
mhm,
does hit a little bit harder when you
yes,
and then you Google a normal eye and right,
mhm,
and then they see like holy crap.
yes, comparing it, yeah,
I did explain to her, obviously, if this gets worse, you could end up with a corneal ulcer, a corneal transplant,
Mhm.
and you just passed the driving test. So, I
Yeah.
mean, that should tell you something. And nope, nope, she was very stern and did not want to, she needed contacts.
Mhm.
And then she explained that she wears contacts full time because she is a psychiatrist
Mhm.
at a hospital. So she works sometimes on call with the emergency department. Like if they
Mhm.
ever enlist anyone into like the psych ward or they
Oh,
need
okay.
like a psych evaluation with anyone. So sometimes she, gets a call in the middle of the night and, at 5 a.m. So
Mhm.
she wants those contacts in ready to go if she needs to drive to work. So that was her rationale. I have work. I can't take days off. I need my contacts. I need to see. And so I offered to write a letter for medical leave of absence because in order to take these drops 4 times a day, I can't have you on call either. Like I'd
Yeah.
rather you just be home with no contacts, no glasses, just blurry vision, but just get your drops in and
Yeah.
still come see me every 2, 3 days. So I offered that. She took it, but she was like, I'm not going to take time off work. And I was like, whatever, just, that's all I can do is take the letter. Yeah, as a new grad, I was hella scared and I did not
Even
deny
writing a
her.
letter like that, that's crazy
Well, I
to
wrote the
me.
letter because I said, yeah, like I mean,
But I
if
wouldn't even know how
that's
to navigate that. I'd be like, what do I even say on this
well, yeah, I
letter?
just wrote, please accept this letter as an official request for medical leave of absence. The patient
Mhm.
has been diagnosed with an eye condition that requires treatment with X drops 4 times a day, blah, blah, blah. So, no, as honestly, as a new grad, trust me, I know that at that point I should have denied more contacts. But what I did, because again, we're people pleasers and I am nervous because she's making me uncomfortable in the room, I offered to do two things.
Mhm.
I spoke with the manager at the practice. And so I explained the situation and I said, listen, I don't want to get sued. I don't want this girl to like lose her vision. She refuses to pay for glasses. Can we give her something for free? So
Oh,
that
yeah.
I did. I asked, that was I've never done that sort of a request before. So the manager was off obviously like, okay, this is something serious. Like it matters to you. Or I did ask, can we get some sort of cheap lenses for free in a cheap broken frame, whatever, I don't
Yeah.
care. Manager said no. Of course, it was a retail location. They couldn't offer that.
Mhm.
But they did offer like a discount. She could
Yeah.
get something for 50% off and, whatever. I believe the patient took the offer. But then
Mhm.
again, it's like it takes time to make glasses. Glasses come in like 2 weeks. So then I'm stuck again. And then I said, you know what? Okay, I'm not going to give you monthly reusables. I am going
Mhm.
to give you daily contact lenses in trial pairs. Like
Yeah.
I'm only going to release a 5 pack of trials at a time. So if I'm seeing you every 3 to 5 days, based on the days that I'm working there, obviously, I threw out her moldy contacts. And she was
Yeah.
pissed, but I said, no, I have to throw these out because you can get an infection from these ones. I'm going to give you daily disposables. There's 5 in a pack, and your follow up is in 3 days. So, like,
Mhm.
I know, like, you can wear these. I'm not going to tell you to sleep in them. I want you to remove them when you're sleeping and then put in a fresh pair. But, like, whatever at that point, I don't know. Do you, at least they're more breathable and
Yeah.
you're going to replace them. So that's what I did. And
Yeah.
then I documented, but I really felt bullied into that situation of just like, yeah, like and I felt like my back was against the wall. Like what are you supposed to do with a contact lens abuser like that? Even if they do agree to get glasses as a backup pair, yeah, they're not ready right then and there. So
Yeah.
and then what if they don't meet the driving requirements or what if their eyes are like so infected? What are you going to do with this person sitting in your chair and they need their vision like right then and there to go home and to I don't
I
know
mean,
what else I could have done.
honestly, I would have done the same thing as you. Yeah, I try to switch them to daily disposable? Did you have the trials in stock at the time to like give to
Yeah,
her?
because well, not the perfect number, right? But
Yeah.
if she was like, I remember she was around a -6, so I probably
Mhm.
grabbed whatever trials in a -6 that I could find. And and I remember when she came for her follow-up, oh my gosh, she was wearing the first pair. And she said it like again, this girl, she had no chill. She was just like, yeah, no, I didn't open up the other pairs yet. Like, I'm just wearing this one. I feel fine. And I'm like,
So
not what?
I think at that,
You
like,
work in healthcare.
yeah,
How do you not understand what
I
I've
know.
just told you?
I feel
Yeah,
like we
she's
make
crazy.
the worst patients sometimes. But
Yeah.
yeah, I don't know. I think if she said she was wearing that first pair for the 3 days, I'd be like, now I'd be like, that's it. You're not getting nothing from me. You're
Yeah.
not getting trials. You're not getting anything. I mean, again, I know
Well,
the
then what do
glasses
you,
aren't ready.
but then what do you do? Because again, I'm a
Oh,
new grad monitoring this patient with infiltrates. Like what I have to follow through and make sure she also doesn't get worse. I remember I
right,
followed up with her for probably almost 2 to 3 weeks. And I
right.
had like 4 to 5 follow-ups with her because again, she's on the steroids. I got to do the IOP check. She's on
Yes.
Miro. She's on artificial tears.
Actually,
I
no,
got
I
to,
backtrack. You're right. I
yes.
can't just kick her out of my chair.
You can't just kick her out
I know.
unless you refer
Okay,
her
no, you
to
know what?
another OD,
Yeah.
right?
No, I would, yes. Okay, so I would continue with the follow-ups. I would see, was she at least healing a little bit by that third, by that
I remember she was
follow-up?
getting a little bit better. Her
A little bit
infiltrates
better.
were, some of them were old and they weren't going away. But some of them were healing. Her edema was getting better. I remember her vision was best corrected up to 2030 and no more than that.
Okay,
And after about 3 weeks, I think she was lost to follow-up care.
okay.
Because
But I
again, then
would,
my staff tried to call her and then, she just never came back.
I think for those daily contacts, I would tell her to take them out of her eyes, and she had to put in a fresh new one. And then, yeah, I mean, I guess you would just follow up with her until everything went back to normal.
Yeah.
But then I would just be asking every day when one of those glasses coming in and be like, oh my
Yeah.
God.
Yeah. I
Like, did she even
remember
pick
she
up the
did.
glasses?
She did. She did get the glasses. I think they came after about 2 weeks.
Oh, yeah.
Um, and the only, I guess, like one tip that new grads can kind of take away from this, I have found that over the years, I, like I said, these people are a personality type, so they're
Yeah.
also very stubborn in their ways because they've never gotten an infection. They don't know the consequences. No matter
Hmm.
how much time you spend educating them on contact lens hygiene, I
Hmm.
really don't think they give a shit.
Yeah.
But when you try to explain to them that, it's just like insurance. I mean, you drive your car every day. You have to have car insurance. It's not saying that you will get into an accident, but God forbid, the day you get into an accident, that's what the insurance is for.
Hmm.
Your glasses are your insurance. You can wear your contacts. I don't care. Don't tell me what you do with them. You make out with them, you sleep with them, whatever you want to do with them. I don't care. You need glasses on your nightstand. That is your insurance. Your glasses should just be on your nightstand by your bedside every single night, and they should be updated at least every 5 years. And I find that that conversation really kind of changes their mind a little bit to just be
Yeah.
like, okay, you're not trying to sell me something. I get it. You're
And yeah,
lecturing.
I'll mention because I feel like when people think of glasses, they're like, oh my God, especially if you're a
Hmm.
-6 and more, they feel like they have to spend so
So
much.
much money.
But I'm
Yeah.
like, you don't have to switch these up every year. This is like, you're
Yeah.
not wearing these all the time. This is something you can switch up, like you said, every 5, 6, 7 years, whatever,
Yeah.
because you're not wearing them all the time. So
Yeah.
just spend the money on a decent pair of glasses. It doesn't have to be expensive.
No,
But
not at
again, it's
all.
like that emphasizing that point of this is your backup plan to if something happens with your contacts,
Yeah.
right?
You're just taking it's just insurance. Like you never, yeah, you might be the lucky one who doesn't get an infection for 20 years wearing
Hmm.
three lenses out of those 20 years. You just never know. It's all, I feel like it should become a law that like just like with car insurance, like you legally cannot drive without insurance or else you will
Hmm.
get a ticket, right?
Hmm.
Why are patients allowed to have contact lenses if they do
But
not
yeah,
bring a physical pair of glasses to their eye exam to
I know.
prove that they own a pair? That
I
should
agree.
honestly be a rule. Whether they're wearing it or not, who knows and who cares? But
Hmm.
bring a pair to the eye exam
And
and
it's
then you
like
get your contact lenses. Like it
you
should
can,
be like a safety thing.
and I don't like, yeah, even with glasses, like if someone's like, I don't have the time to like buy glasses, whatever,
Get them online. Go
get
to
them
who
online.
cares?
I
Don't
will
buy them
help
for
you buy
me.
them online. I will help you buy
Yes.
a $50 pair of your -6 glasses. They're going to be
Yeah.
thick as hell, but at least you have
Just at least you have
something.
something. Yeah.
Yeah.
So
So,
true.
and I never advocate for buying online, but in this case, for someone like this, where you're
Mhm.
like, your care, they're not taking that advice, and you're trying everything you can for this patient to be compliant, and now you're kind of in a legal position where you're like, well, what do I do?
Mhm.
I would be like, I'd throw that in the air. I'd be like, you know what? I will help you buy this $50 pair of glasses online
Yeah.
because I mean, if you're buying contacts, you have enough to buy these glasses.
Yeah.
So, I mean, I don't understand the problem, but I don't know. My my tolerance level for these kind of people have diminished.
Um
Diminished. So I
they're they're not the
I
most exciting patient to talk with in the exam
yeah.
room. Definitely
But
not.
I'm getting better at confrontation. I'm ready for a fight every day now. So I'm like, you want to go?
Yes.
Let's go. Let's have this conversation and I will throw my pigeon head into the gate and be
You know
like,
what's
you
so
want to talk
true?
about this? Let's do it.
It's
Because
so true.
I
Maybe
feel like
year five out of like the new grad life, year five is the peak season where
I
like
think,
we're
yeah,
confident, we're ready to talk back, we're ready to say no to our patients and tell them they're wrong, and we're ready to discharge patients and decline exams.
yeah,
Like as a new grad, it's all like, oh, like I have to
yeah,
see
no,
everybody. Oh,
yeah,
I can't. Oh, I don't want to upset anyone. Now I'm like, what?
yeah,
What do you want? What? Like I'm just ready to, you're so right. I'm like
no,
ready to fight all the time.
yeah, me too. I that's one thing I've learned, like just and especially being in a practice that's more medical heavy, that just brings
Hmm.
in a certain kind of clientele. Yes, I am ready to argue a point every single time.
Yeah.
Like like I'm always smiling and happy, but if I have to like again deal with these kind of people, I will turn right around and be like, okay, I'm gonna have to tell you something.
So that was a really tough patient. I still remember, man. Yeah, I remember that woman till this day because it was a really hard moment as a new grad OD to be like, I learned about what the right thing to do is. I can't do the right thing. Like
Well, so
I
what
don't
would you
have
do
the
this
courage
time?
to.
Like, how would you handle it now? Like, say you gave them the dailies, they came back, and then she was like, "Oh, I'm still in the dailies that, I put on my eye from that first day."
Here's the thing. Okay, if that exact, so I guess there's two ways that I handle situations now. If luckily I have not actually met a contact lens abuser since then that has a
Hmm.
lot going on, no infections, no infiltrates, knock on wood, luckily. To be honest, if I handle that sort of a patient now, I think I feel very fortunate now to have more confidence in being an associate doctor long term at a practice where I do have more autonomy in decision making, especially when it comes to the optical. I also have more of an income now where, I can offer to literally just pay for my patient's glasses if needed. And
Hmm.
I'm a practice owner. So, yeah, I can literally just be like, listen, I need you in glasses. Just take these glasses for free. I'll edge them right now. They'll be made in 20 minutes, or I'll chat with the opticians at the other practice that I work at as an associate and be like, listen, give her a discount. I'll pay for the rest, whatever.
Yeah.
As a new grad, absolutely not. I had no confidence to do that, no
Yeah.
idea I could even do that, and no money and no salary to give away because I'm trying to pay my loans. Like, no, thank you. You can get your infiltrates, whatever. I need to pay off the student debt. Um,
Yeah.
So there's more flexibility for me, I guess, more salt and pepper OD to
That seasoned
get
OD.
glasses.
Yeah.
And then I would absolutely not, because if I can give her those glasses, I'd be like, yeah, you're not getting any contacts from me
Yeah.
until the day I give you the green light to wear them again.
Hmm.
And I'm giving you this medical letter, leave of absence, so that you take work off so you can handle this. And I'm going to follow up with you every day,
Yeah.
not to make money, but to literally just make sure that
Yeah.
you need to be babied now at this
Yeah.
point.
But these patients also, they are not like loyal patients, right? They just go
No,
from
they're not.
clinic to clinic to clinic. So it's like
Exactly.
brand new, or they haven't seen you for like 5 or 6 years, and you're like,
Exactly.
sorry, like what, where did you
Where'd you come
get, like,
from?
when was your
Mm-hmm.
last eye exam? Oh, 5 years ago. Oh, okay. So we haven't been
Yep.
checking regularly what's been going on with the contacts. And
Yep.
you just have to stand your ground, and it'll come with, I mean, it also depends on anyone's personality. If you're a new grad but you already have an assertive personality, it'll be easier for you. But
Easier.
I think for
Yeah.
both of us, we were both like, la la la, like we just want to
Little
please,
scaredy
yeah, please
cats.
everyone, make everyone happy, get our 5-star Google rating, and call it a day.
Honestly,
And
I guess I feel like I didn't even pay attention to Google ratings at that point. I literally just felt for any patient that would be angry or rude, it made me feel so uncomfortable in the exam room that I would just say or do whatever the patient wanted sometimes, because I was like, I don't want you to get like more angry, rude, start screaming at me. And yeah, those types of patients, I think as a new grad, it's really hard, especially when you work alone.
mhm.
Like especially in those retail kind of corporate settings.
Yes.
I was never with another doctor. I was always there by myself. There was no other doctor to talk to like collaborate with, ask
Mhm.
questions to. And so you're literally there by yourself, just being like, I don't know how to handle this
And yeah,
person,
that was me when I
right?
was a new
There's no
grad too. I was by
guidance.
myself, and you're just kind of like,
Yeah.
okay, let's just figure this out.
Yeah.
Hopefully this works. But you know
Yeah.
what? We're okay now. No one went blind. Everyone's fine.
Yeah. Document, document, document.
Yeah.
I hope this case resonated with everyone listening. And yeah, let us know if you would have handled that situation differently, if you handled it pretty much the same as me, like a little wuss, just being like, here you go, here are your trials. But yeah, and let us know if you want to hear more of these case reflections, because actually I'm liking it too. I'm really glad we did this one today. I
Yeah.
kind of missed this, like talking
Yeah.
about patient situations, because yeah, it brings us back down to memory lane,
Yeah.
which
Or
is
if anyone
fun.
even has tips on how to convince patients to get glasses along with their contacts, like how you had that,
Yeah.
how you compared it to insurance. I mean, that's a good one. If
Hmm.
anyone else has any tips, that would be good to share.
Yeah.
Thanks for listening to Four Eyes, the podcast series brought to you by Young OD Connect. Be sure to subscribe and follow us on Instagram or YouTube at Four Eyes Optom for more content. We'll see you guys next time. Bye.
Bye.